from the perspective of organizations and their current state, and are they ready for centralized patching, or where do they begin? None of this is possible without visibility of the inventory, right? You have to have good visibility of what you have connected to the network, and then obviously every additional amount of fidelity that you have about that device. What software revision, IP, MAC address, and what's it talking to, which network segment is it on? All of that visibility, I think, is a good starting point. You have to have it. Even as good as CMMSs are and the HTM departments are, there are departments bringing rental equipment in and out all day and night. And that accumulates over a 12-month period. Every year, very quickly, you get some large amount of error in your inventory. Well, when these tools like Mitigate, there's lots of good ones out there. Mitigate can see what's there. You're not so reliant on, were we lucky enough for the device to come through HTM and we know it's here? So those tools, I think, are a good starting point. And, those tools tell you a lot about the device from a risk perspective too. They're not just visibility. They tell you, they give you a lot of context about the operating systems, and potentially in some cases, or many, what is the revision on it? There's a lot of validation that you have to do even with those tools, but they're very good starting points for an HTM department to know what's connected. And then obviously, I mentioned earlier, you have visibility, and even if you want to pursue, risk reduction, you've got to begin to identify resourcing within your department that's responsible and accountable. And you need to have some guidelines and internal policies for managing security.
Yeah, I just want to add on about the Mitigate too. We also use that for our life cycles too, because now we can start pinpointing those devices that are running XP or those non-supported operating systems. So that helps us be able to determine priority and capitalization along. There's some other tools in there you can use, but that's another thing that we use Mitigate for.
Appreciate that. I am curious though, because Olin, I know that when you were discussing centralized patch management, you did a lot of work with vendors. But Pete also noticed that he had to call in too. Can you talk about what information you were able to gather from manufacturers and how that might inform this visibility?
So you have visibility of your devices. And now you need to go identify what is their as-built configuration state, right? And from the patching perspective, I mean, there's a lot that goes into that. Ultimately, when you're assessing a device, you're getting an MDS2 and SBOM. We have dedicated teams, obviously, here at First. That's all they do, and we have a large knowledge base established for this. And we are looking to discover lots of things. Are there web browsers loaded on medical devices as they're shipped that aren't necessary for the function of the machine, right? So are there device level controls that can be configured? And then we get into software state, firmware state, patching revision levels. That interaction with the vendors, you've got to get beyond salespeople. We need to get to engineering. So it can be tricky. You have to be persistent. You have to have dedicated resources. And for every model of device that, Pete's managing in this way, there is an effort to make discovery with the OEM of what the device is capable of. What is its current revision? Can it be updated? Have they validated? And, you can't just take every Microsoft update, for instance. It has to be a validated update. Well, there's a lot of phone calls, a lot of footwork for every one of those instances in engaging the OEM to determine that. And so, we've been with Pete for a long time. we've augmented his team and provided those service for many, many years. His team is continually maturing and growing, and so they're doing as much of that as we are. But that's the first step to really patching these devices with whatever mechanism we put in place. You need to know which patch that you're going to configure for what group and which devices are going to take which ones. And that all begins with lots of research and validation with the MDM. That's the most time consuming part. It can be very resource intensive. So there has to be dedicated analyst resources to that, either internally or, augmenting your staff with somebody like First that does that. Have teams dedicated to it, because that's where you get the information that you configure whatever your patching solution is going to use to say, we've validated that this is an appropriate and safe patch for this device to take. And then obviously you apply it, and the HTM teams do their normal performance validation and put it back in production.
Yeah, well said. I think, like I said, the staffing is really the hard part, to making sure you get a good team to be able to do all that research. It takes a long time. It really does.
I guess as we kind of wind down, I have more of a tangential question, because I think it's interesting, because medical device security, again, is one of those things that a lot of people just can't get their arms around. And even some of the largest health systems in the country have admitted that they just sort of accept a certain amount of risk. I'm always curious as to, how do you deem what's seen as acceptable risk? How is that calculated? And especially in a clinical environment, is there really indeed a term of acceptable risk? And how do you sort of marry those two ideas?
Yeah, that's a good question. I think it comes down, I just lost the word. I should have written it down while you were talking. When you look at something like that, you got to have compensating controls. That's what I'm saying. So if something cannot be updated, what is the next thing you can do to protect that device? Is rather that put it on a segregated VLAN, cut it off from the network, maybe. It just depends on what that device is used for. But those are the risks that you have to, decide in your organization. If it's running on XP and, the device is, multi-million-dollar device to replace, but your volume is not there, your patient load or volume is not there to have that device replaced, then you've got to look at other ways to secure that. And that's where you get into acceptable risk. And that's when we're talking about looking at VLANs, using the tools that you have to be able to, make that as secure as possible on the network.
I agree with that.
Nothing to add.
Well, there's a lot of nuance there, and it really is organization dependent. But I think generally that applies. What he shared applies everywhere. I would. So I'll just add a tidbit that, from Pete's perspective and teams like his, their focus is patient care and device availability. So they're always going to have slightly less tolerance for acceptable risk than a non-clinical services provider. And so they're going to pursue those compensating controls. They don't have the luxury of just replacing the widget like an enterprise team would when it doesn't meet the standard. And they're not going to accept any more risk than is necessary for patient safety. So those HTM teams will focus on the update controls and the mitigating controls.
I think that's why the onboarding process is so important, because that's where you'll identify those weaknesses when you do the onboarding. That's why the onboarding policy and procedure has to be well thought through.
What I'm getting is, do something, and HTM needs a seat at the table. And I don't know if Pete, right? I think that, because what I've always heard is that there's this siloed nature. between biomed and IT and security. And it's really a joint effort, and it feels like Texas
Well-
Health has really sort of prioritized that. I mean, imagine it's your work
Right.
that sort of fueled that too.
Just real quick, security should be separated from IT. It should be its own standalone thing. Because IT is just like, they're fixing computers and doing what we're doing to make the customer happy. Whereas, it's the security piece is really looking at how do we protect, our data and infrastructure. So we just wanted to point that out.
You can add that in. No, I merely meant that everyone should be talking to everyone. But yeah, no, I hear what
Yes.
you're saying, and I think that's very important. Absolutely. I think that unless there are any audience questions, that we can wind down a bit early today. I want to thank you all so much for joining us today. But please be sure to reach out to our team via email or on LinkedIn and connect with us there, so you can keep in touch with our educational resources as well. A recording of this presentation and the slides will be sent to you guys in the coming days. And thank you again on behalf of First Self Advisory. I hope you all have a wonderful day. Thank you so much.
Thank you all.
Thank you all.